Hello everyone. This is a detailed overview of the systemic circuit. We're basically just going to be going through all of the arteries in sequence, right, as they go through the brain, the arm, and down the rest of the body. So of course the systemic circuit begins with the aortic arch. Blood has been oxygenated. It's been pumped from the left ventricle into the aortic arch. There are 5 branches off the aortic arch. There's the left and right coronary arteries, the brachiocephalic artery, the left common carotid, and the subclavian. So we're going to go through each of these together. You'll notice that on the picture I have an arrow pointing to the aortic arch. This will be the case for all the slides as well, so make sure you look at where the arrow is pointing. So, starting with the coronary arteries, which branch right off the aortic arch. The coronary artery, as you guys are aware of, supplies the heart. There is both a left and a right coronary artery. The left coronary artery branches into the circumflex artery, the anterior interventricular artery, and the left marginal artery. The right coronary artery branches into the posterior interventricular artery and the right marginal artery, and we're going to go through what each of these arteries are supplying. So the circumflex artery is supplying the left atrium. There isn't a circumflex artery on the right because your coronary artery on the right is directly supplying your right atrium. The left marginal artery is, of course, supplying the left ventricle. The anterior interventricular artery is supplying the myocardium and the interventricular septum. The right marginal artery is, of course, supplying the right ventricle. And the posterior interventricular artery is supplying the interventricular septum. So those are the arteries that are stemming from your coronary artery, supplying your heart with oxygenated blood. So the first major branch off your aortic arch after the coronary branches is the brachiocephalic artery. The brachiocephalic artery in total supplies the head, neck, and the arm, and it branches into the right common carotid and the right subclavian. This is a really good point in time to once again let you guys know that understanding what the names of arteries mean is the perfect way to determine what they're supplying oxygenated blood to. So brachio means arm, cephalic means head, therefore you can deduce that the brachiocephalic artery is supplying blood to the head, neck, and the arm. And so the brachiocephalic artery branches into the right common carotid and the right subclavian. And you can see my arrow pointing to it right there. So starting with the carotid arteries, your left common carotid being the next large branch off the aortic arch after the brachiocephalic artery. So the right common carotid is coming from your brachiocephalic artery. The left common carotid is coming directly off the aortic arch. Your carotids are going to branch into the internal and external carotids. And so you have both a right and left internal and external carotid. And these arteries are supplying the face and the brain. And you can see I have your common carotids identified on the picture here. So the external carotid supplies blood to your face and your teeth so that you can, when you smile, you can smile. The external carotid branches into the internal maxillary artery, the superficial temporal artery, and the occipital artery. The maxillary artery is not shown, but it supplies the teeth. Maxilla is your teeth, right? So the maxillary artery supplies your teeth. The superficial temporal artery is going to supply the neck and the head. The occipital artery is going to supply the back of the scalp and any of the deep neck muscles. Now the internal carotid also supplies the brain, eyes, and the face. The internal carotid branches into the ophthalmic artery and the medial and anterior cerebral arteries. I'll also make note that the internal carotid contributes to the formation of the circle of Willis, which is involved in the circulation in your brain. Now, the ophthalmic artery arises from the internal carotid, and it supplies blood to the orbit, nose, face, and the meninges. The meninges being, of course, your dura mater, your pia mater, and your arachnoid mater, right? Those are those meninges that are covering your brain. The cerebral arteries are not shown here, but they're, of course, supplying your cerebrum. Now, moving on, we're now in the arm, looking at the right and left subclavian arteries. The right subclavian coming from the Brachiocephalic Artery. The left subclavian is coming directly off your aortic arch. These arteries are supplying the arm, as well as some of the cervical regions of your neck. The subclavian arteries branch into your vertebral artery, your costocervical artery, your thyrocervical artery, and your internal thoracic artery. The subclavian also gives rise to the axillary artery in your shoulder. So the vertebral artery is the first small branch off the subclavian that supplies the brain stem. The thyrocervical artery supplies the cervical region of the body, right? And so that's the next branch off your subclavian. Now, the costocervical artery is the third small branch that's also supplying the cervical region of the body. The last is the internal thoracic. However, the internal thoracic is not shown. This is, of course, supplying the thoracic region of the body. Now, the axillary artery arises from the subclavian artery after the costocervical branch. And so the axillary artery is supplying the upper arm and the armpit. It branches into the humeral circumflex artery, the subscapular artery, and the superior thoracic artery. And it also gives rise to the brachial artery. The humeral circumflex artery supplies the head of the humerus and the shoulder joint. The subscapular artery, which is not shown, supplies the subscapularis muscle as well as the latissimus dorsi muscle. The superior thoracic artery, also not shown, supplies the intercostal muscles of the ribs. Now, the brachial artery, once again, arises from the axillary artery after the humeral circumflex branch. The brachial artery supplies the lower arm and the hand. It branches into the radial artery, the ulnar artery, and the radial and ulnar arteries converge at the hand to form the palmar arches. Now, the ulnar artery, as you can see, supplies the lower arm. The radial artery also supplies the lower arm. And the palmar arches supply the hands. Okay, so now we've done the head and we've done the arms. Now we're going to work our way down the rest of the body via the descending aorta. The descending aorta is also known as the dorsal aorta. It's basically just a continuation of the aortic arch that carries blood to the rest of the body. It branches off into several major arteries, one of which is the celiac, the superior mesenteric, the renal, the inferior mesenteric, the gonadal, and the common iliac. And so we're going to go through each of these. Now, the celiac is the first major branch off the dorsal aorta. And the reason why it's major is because it branches into arteries that basically supply the entirety of the gastrointestinal system. It branches into the hepatic artery, the gastric artery, the splenic artery, the gastroepiploic artery, the pancreatic duodenal artery, and then, of course, the superior mesenteric artery, which meets back at the dorsal aorta, which is why the superior mesenteric is also considered a branch off the dorsal aorta. Now, starting with the gastric artery supplies the stomach. Also, another good example of why you should know what terms mean, because if you know that gastric is pertaining to the stomach, you'll be able to deduce that the gastric artery is supplying the stomach. The hepatic artery is supplying the liver. Hepatic, of course, means pertaining to the liver. The splenic artery is supplying the spleen. Now, the gastroepiploic artery is not shown, but it is an important artery that also supplies the stomach and what's called the omentum, which is just this fold of the visceral peritoneum that connects organs. The pancreatico-duodenal artery, also not shown, supplies your pancreas and the duodenum of the small intestine. Now, coming back to the descending aorta, right now we're going to go through the rest of the branches in order as we go down, starting with the superior mesenteric artery, which is going to supply the small intestine. Just a rule of thumb, if it has mesenteric in the name, generally it's supplying the intestine, right? There are a few exceptions across organisms, but generally when it has mesenteric in the name, it's supplying the intestine. Next is the renal artery supplying the kidney, and of course renal means pertaining to the kidney. The inferior mesenteric artery is supplying the large intestine or the colon. The gonadal artery, which is not shown, supplies the gonads. In females, the gonadal artery is what becomes the ovarian artery to supply the ovaries. Now, once we get down to the very end of the descending aorta, it bifurcates into the common iliac arteries that are going to supply the lower body. Your legs, for instance, your hind limbs. The common iliac arteries branch into the external iliac and the internal iliac. The internal iliac arteries supply your lumbar, sacral, and gluteal regions of the body. The external iliac supplies the rest of the lower body, the lower hind limbs, right? It branches into your femoral artery and the inferior epigastric artery. The inferior epigastric artery supplies the umbilicus, or your belly button, as well as the abdominal body wall. The femoral artery arises from the external iliac artery, and it's going to go on to supply the knee as well as the upper and lower leg. So it branches, for instance, into the deep femoral artery, which is going to supply your upper hind limb, but it also gives rise to the popliteal artery. And the popliteal artery, once again, arises from the femoral artery. It is the popliteal artery that supplies the knee and your lower leg, because it branches into the posterior tibial artery and the anterior tibial artery. The posterior tibial artery, of course, is going to supply the lower leg and the foot. And then the anterior tibial artery is also going to supply the lower leg and the foot. So that is almost in its entirety, a detailed overview of the systemic circuit in your body for the circulatory system. I do hope this helps.